Hi, it's your coaching colleague, Dr. Brenda Bowers, with a Because We Are in the World update on COVID 19 as we look at the state of Wisconsin, the county and city of Milwaukee, and then that global perspective from our colleagues at Johns Hopkins University in Medicine. Today, a couple of things have happened. One on the Milwaukee front. Eugene Kane, former columnist for the Milwaukee Journal Sentinel. Some of you may know, African American male. He did die in his home, and the COVID 19 test for him is pending. The medical examiner is indicating that should be available on Friday afternoon, and it will be at that time or thereafter that the cause of his death will be released and be finalized. Also, the Safer at Home order has been extended. Governor Evers has extended that until May 26th. So we can just know that on April 24th, that's not ending. And I know, especially for those of you that are small business owners and even larger business owners and just constituents in general, we get very concerned when businesses are not able to be open, because then that means that money isn't pushing through and revenue makes the economy work. People get paid, they spend money places, hopefully, that they trust, in places that are providing good service and product. And then those business owners continue to invest in making their business better. And we all continue to see capitalism as at its finest in America when that happens. But we've also reached a high in unemployment for the United States, over 5 million filing for unemployment. At the height of the Great Recession, unemployment was at 10%, and we're looking at close to 20. So there are a lot of things that are causing heightened anxiety. So the first thing I want to say, because we're in the world, is that we have to keep our heads about ourselves. We just do. We're hearing things we don't want to hear. We're in situations we don't want to be in, but we are still in the world. So we have to manage accordingly. As such, I want to look at some of the stats that we look at on a daily basis of COVID 19, starting with our look at the state of Wisconsin. So here we see, thanks to our colleagues at Fox 6 News here, fox6now.com provides, I have found, the easiest for me to at least navigate as I'm sharing briefly with you every day. So today, at a state level, cases confirmed 3,946 in Wisconsin, with 198 deaths. That's what we're looking like on a state level. But then let's look at how the state reports that out. And on the right hand side of the screen, you see the negative test results are just about at 41,000, with the positive results right around that 3,800 mark, 3,875. So that lets us know that we're a little over 44,000 who have been tested. Of the 44,000 who have been tested, we're looking at the 3,875 that are positive, and 1,121 of those, or 29%, are requiring hospitalization. Wisconsin has been maintaining about that 29% level for those hospitalized, even though the number of hospitalized go up. Because remember, the more tests we get, you'll see those higher numbers, but because there's more tests, that denominator is bigger, so then we're still staying around that 29%. And the deaths on the state site, if you look at that now, you're going to see that 197 number. So as we then look at Milwaukee County, and I just refreshed this data. So we see 2006 confirmed cases in Milwaukee County. Our ethnicity breakdown is still showing that large number of the confirmed cases are Black or African American. And then we have further breakdown, 444 of white. Then we have those that are not reported, which is a large number, is 343. So as we continue to look at that race ethnicity breakdown, the African American population continues to be the most confirmed, as well as the most deaths. So the question is, why is that, Dr. Bowers? Well, the short answer is, as a people, Blacks, African Americans, didn't stop having high blood pressure because of COVID, didn't stop having heart disease because of COVID, didn't stop having COPD and other respiratory issues because of COVID, did not stop being a population that has health disparities because of COVID, or even healthcare disparities because of COVID. This just pronounces a stat or a truth that already existed. It's being highlighted. So there is responsibility. I speak as an African American woman that I have a responsibility to do everything I can to stay as healthy as I can with my issues. I have a myriad of health issues, and it's my responsibility to do the best that I can, because I'm already in a marginalized population that, whatever you look at as the medical cause, you're going to find specific groups that have a higher propensity. So that's more of the why behind that whole racial piece. We cannot underscore enough that we have to change how we live. We have to change our comorbidities. We have to continue to make strides that we have made in our healthcare systems to ensure that access and treatment are equal across all persons, so that when we get in a pandemic, we're not suffering in the manner which we unfortunately see right now. And we do see the cumulative positive cases in that lower left. While I am here on the left-hand side, I want to go ahead and look at our other stratifications, which is by age. Everybody's impacted. So please, please, please make sure that our young people are practicing good hand washing techniques, not touching their face, not touching others, staying 6 feet apart, staying safer at home, not doing non-essential travel. That it's important at all ages. Again, here with our females, we know what we should look for, and that is more females with confirmed cases. Continues to hold true, but the male cases, 905, females 1,099, and we do now have an identified transgender as a confirmed case as well, which is new. And then when we look at confirmed by city, of course, Milwaukee, of that 2006, is 1,500 of that number. So when we go to the right side and we similarly look at the dashboard, we have 103 deaths. Of those 103 deaths, when we look at that by race, we have 63 Black, we have 33 white, 5 Hispanic, then we have our one where it is one race, non-Hispanic, and then we have 2 or more races. So one that's non-Hispanic, non-Black, and then one that is 2 or more races. So when we look at the ethnicity of the deaths of the 103 number is what we're looking at now. So the 103 number, 63 of those African American. Age range. When we look at the death age range, then you see that we are skewing much more to the right, to the older population as it relates to death, with the highest death age being between the ages of 70 and 79 in Milwaukee County. And when we look at gender, we know what we should expect, which is here more females test positive, but more males actually die. So of that 103 number, 58 of them have been males and 45 of them females. And then in our bottom right-hand corner, we again get to see the cumulative number of the reported deaths. Again, as we look at this, we want to make sure that the number of tests become so critical. So as you're hearing more about the test numbers, that's because the more we're testing, the more we're able to deal with milder cases of the disease when we have a higher number in the pool, if you will. Let's turn that off a little bit. Okay, that's a little better. So now when we look at our Johns Hopkins map, few extra minutes on this one today. We're at 2.1 million confirmed. United States has a huge lead from anyone else with 658,263 confirmed cases. Now, remember on our right-hand side, number of deaths. And number of deaths, we have cities, and we see New York, 1, 2, 3, 4th down, 11,477 deaths. And then in this same tab, because this database, interactive database, is expanding its purpose, which is very helpful. So under that same box, we have total recovered, which is 540,684. That's great. How do we get that recovered number? Because it's against that tested number of 2.1. And you see that the United States is 4th down in those recovered at 53,697 reported total recovery. Now over to the right, we see total tested in the United States. So in the United States, we have tested over 3 million individuals. So this is important. This shows us how many tests are out there and how many have come back. 3.2 million is a great number, except when it is compared to the number of cases that we have confirmed, this 658,000, and then the number of deaths that we've had in the United States. Then we have not tested enough individuals. So what Johns Hopkins has now done, as they work with the CDC and other reporting and expert think tank groups for us, or providers of key data, they have added a U.S. map. So now we not only see the global view, but now 2 days ago, Johns Hopkins added this whole section on the U.S. by itself. So now we're able to look at that breakdown of number of confirmed in the United States, 629,264, with Queens being the highest at 34,831. So we can scroll through there by county. Those are cases by county. And we're able to see how many of those, how many cases have actually been confirmed. So when we look at this now United States having their own map section on the Johns Hopkins database, that lets us know the importance of the performance of the United States against the whole world. So we see total deaths in the United States. So the United States, we are contending with over 26,000 deaths, 26,708 deaths of this 629,264 confirmed. This is a subset of that number, as are the recovered at 47,763. And we do see that the recovered number is much larger than the number of deaths, which is great. That's what we want to see. Okay, it's not showing us exactly where those are, and that may not have a roll up yet. But what we are able to see now on the Johns Hopkins map is, again, going from our world map view here, which is still incredible data. There's so much data here. I'm giving you highlights. So that's still at that global level, 2.1 million confirmed across the world, 142,735 deaths across the world. And then we can look and see this new map that they've given for the United States, 629,264 cases confirmed in the United States, with the counties of Queens, Kings, Nassau, Bronx, Suffolk, Westchester, Cook, New York, and Wayne leading those top lists of number confirmed. And now we can come over and look at number of deaths in the United States. So the United States has lost 26,708 individuals to COVID, while 47,763 have reported recovery. But yes, when you add 26,000 and 47,000, you are not going to get 629,000. 629,000 are the number of people who were tested and confirmed positive. A subset of that number then are the number of people who have died, and a subset of that number is the number of people that have recovered. And there's a large number that we don't know. We have our asymptomatics, and this is becoming more important because as we